tutorial for chronic care management functions of Hubchart CCM app. We are using Hubchart CCM iPhone version 2.4. Today we're going to talk about Hubchart's functions. Before we start, it is important to remember that moderate and high complexity chronic care management codes, which is 60 minutes and above, can only be done in Build if you've done the CCM work in-house. These codes cannot be outsourced to a third-party CCM company. Throughout this video, we are going to use the acronym PCX, which is short for Patient-Centered Collaborative Exchange. It's a patient-named chat group. On this video, we are going to teach you how to do the following. Number 1, activate a PCX to active CCM. Number 2, forward CCM relevant chats from PCX to the CCM hub. Number 3, enter or edit clinically relevant comments or notes to the CCM entries. Number 4, generate time for CCM entries for staff and provider. Number 5, tracking time progress for the month. Number 6, sending the CCM time or billing. We are going to start with giving you a brief orientation of the homepage of Hubchart CCM. This icon is the inbox where you have all the new messages both received and sent. This icon called Collaboration includes both the PCX and the regular group. We're going to focus today on this icon here, the CCM tool. This button will give you a quick access of all your active CCM patients. This list is very useful as a CCM productivity tool as it shows you the up-to-date CCM time you have done on a patient. So in this example, you got 2 who haven't logged any minutes yet. Patient Ima, Jin, and Fassi, Nate, have no CCM work logged yet. Ricky Burns, on the other hand, is burning with a lot of CCM minutes. You got 75 minutes on the scoreboard. So this is like your scoreboard of your CCM production. We are going back to our main topic today. How can we convert a PCX to active CCM? So here's how we do that. When you press this collaboration logo here and you press this button there, there's 2 types of collaborative group. One is the regular chat group and second is the PCX. Let's do a patient-centered group real quick, then activate it to a CCM case. Let's use test patient as an example. Say, a patient came to your office and for the purpose of CCM, a Medicare patient with 2 or more chronic conditions. Last name, test. First name, patient. Say, his date of birth is January 8, 1938. And say it belongs to that clinic and assign him to that folder. Then we are adding members to this group. Okay, let's add Glenn and Alder. You have to make sure that you verify the identity of the persons that you invite to your PCX to protect patient health information and maintain HIPAA compliance. So how do we activate a PCX to become a CCM case? From the collaboration page, you can search for the patient and open. Second, press the CCM icon to open the CCM page. Third, to activate the PCX group on this version 2.4 is simply enter the CCM start date on this space. Next, you got a verbal consent. So you can either get a written or verbal consent, but starting January 1st, 2017, you are not required to get a written consent anymore. Verbal consent is sufficient. Medicare has made it easier to accomplish CCM. So say you got the consent today, July 27, 2017. Let's check this if you did a care plan which is required to start a CCM. You can get a verbal consent template by going to our website hubchart.io and click on the Freebies tab. On this space, you can put the two chronic qualifying diagnoses. Say, test patient has diabetes and hypertension. So, the requirement to be on CCM is 2 or more diagnoses that could last more than 12 months, and the patient has a risk of exacerbation of the chronic disease leading to deterioration, possible hospitalization, or risk of death. Congratulations! You just activated test patient to be officially on your CCM case list. Simple, right? This here, CCM minutes for this month, automatically totals the CCM time you have entered for the month. So since we activated that patient, test patient, that name should appear here in our CCM list. So we've just showed you how to activate a patient group, PCX, to be part of the CCM program. Next, let's talk about how we can forward CCM relevant chats from PCX to the CCM Hubchart. The PCX contains clinically relevant messages that are sent between members of the collaborative care team. These clinically relevant messages are then forwarded to the CCM module. Those entries can be edited as needed. We can also add more notes and comments as necessary for the CCM work you did. Next, you can complete or edit the entries here on this section. Alright, so let's do this process to our sample patient. We prepared some sample chats here on this patient's PCX. So in this example, Alex has sent me an attention message. We talked about attention and stat messaging in our group messaging instructional video. Alex's message says that this patient has a lesion, described to be a hematoma, and he sends me a picture of the lesion. So how are we going to utilize these clinically relevant chats to be billable? We then do a long press on this message. Then a menu would open on the message bubble. Next, choose CCM on the pop-up menu. These forwards to the CCM module. We can also add more notes and comments here. Say, we reviewed the meds, reviewed the chart, discussed with staff and gave orders. So I will enter reviewed past records. Basically, I reviewed some previous labs, and I also reviewed some medication that could cause the hematoma. So I'll save those entries there. Service month is July, and CCM provider is the staff. Most of the CCM entries are done by the clinical staff. Supervising clinician is me, so I'm gonna put Dr. Smith. So if your staff say your clinical staff, your MA, your PA, your NP, and so on and so forth, supervised by the physician, Dr. Smith. So say this took me about 20 minutes to review labs, records, meds, and so I put 20 minutes here. But my staff did 10 minutes on this episode. So I just put a total of 30 minutes of total CCM time work for this episode. And then save them. So that 20 minutes of work should be there for the month. But I have more billable work here. This picture and I reviewed his labs and I reviewed the medication. So I could forward that again and say that hematoma and I could put a comment. Example, I say, no apparent trauma noted. And I could put discussed with staff and save it. And so that probably took me about, say, 10 minutes. DMD is Dr. Smith again. So the total time that I've generated for this patient is 10 minutes. So 30 on my earlier input and 10 minutes on this picture, I get 40 minutes of total cumulative CCM time so far this month. So when you go to your CCM module, you see the total time for the month so far as 40 minutes. Let's talk a little bit about G0506, which is an add-on code that you can bill with Encounter prior to initiating a CCM. So say the patient walks in the clinic and the patient was seen as a regular follow-up, so that would be a 99213 for an office visit or 99308 in a nursing home. Then you complete the components of the G0506, which are the lists here. Let's check them. While CCM is billed at the end of the 30-day period, G0506 is billed on the day you say the patient got the consent for CCM. We should go to this button here which showed the accumulated minutes. So say for July, we have so far generated 40 minutes and the CPT code for a 20-minute CCM time is a 99490. So for this last part, how do we send this to the biller? At the end of the month, you can generate a report to your biller to send a billable report. Press the button here, Generate Email Report. Then, you input Place of Service. Then it will open to your default email for editing prior to sending to your email. It contains the essential information your biller needs to be able to bill, such as the patient's name, date of birth, diagnosis, and insurance and place of service, billing period, month, and total CCM time. All of these work are accomplished without leaving the app platform. That's it for this session. If you have any questions, go to our website, hubchart.io, or you can email me at info@hubchart.io. That's it for now.